Hi, my name is Alejandro Andrade. I will be giving a talk on breaking the code. This will deal primarily with ICD-10 outpatient documentation. Quick disclaimer is that I am not an ICD-10 coder. I do not represent any payer sources. And this presentation is based on independent research and discussion with our certified ICD-10 coder. Some of the information was gathered from the American Academy of Family Physicians, along from the Family Practice Management Journal. So the objectives of the talk will be why ICD-10, ICD-10 code basics. The key to ICD-10 is documented specifics. And where I want to spend most of my time is the workflow examples in Cerner, and less time on these first three objectives. So ICD-10 is here. Its implementation will start on October 1st, 2015. These are the new changes by the Centers of Medicare and Medicaid Services and the National Center for Health Statistics. ICD-10 will have an increase in codes. From ICD-9, there's currently 14,000. Now there's going to be about approximately 69,000 codes. The ICD-10 provides more detailed information about the patient's condition to support research, population health, and value-based payment. While all this is important, the one thing that we're going to focus on is value-based payment. So value-based payment is something that most of the payer sources will be switching to. Currently, we are based on CPT codes, which doesn't really capture the complexity or the acuity of the patient. For example, if you have a level 3 new patient here for visits for a healthy adult and he has allergies, it can technically pay the same as a level 3 new patient who has chronically ill and has an acute pneumonia. The reason being is that one can document a higher level of history and exam findings, which can change the level of services. As I mentioned, healthcare will be shifting from this fee-for-service payment to a value-based payment. This will reward providers for meeting quality and efficiency measures. The acuity of a practice patient population will affect the year-end payment reconciliation, meaning, for example, if Medicare were to look at our clinic Magnolia, they would say, well, how many sick patients do you have? If you have this many, you're allowed this much money. Medicare will use acuity as one of its factors for monetary compensation, as I mentioned. Medicare and other third-payer parties will get this information from the reported diagnosis codes. So once again, we have to be very specific in our diagnosis codes to be able to give a picture to the payers of what's going on with our patients. So currently, we have one code in ICD-10 for any helpless soul who gets run over by a spaceship. ICD-10 will offer 30 codes related to spacecraft-related injuries. So let's take a closer look at this alien-like ICD-10, which is not really that alien-like. So ICD-9 currently has 5 digits. There is a category, the first 3. Then the last 2 numbers talk about the etiology, anatomical site, and manifestations. ICD-10 still has the category, the etiology, the anatomical site, but we'll focus primarily on the severity as well and what's called an extension code. So you don't have to memorize this, but I just wanted to break it down for you guys to understand what ICD-10 means. So, as I mentioned, it consists of 3 to 7 characters. The first is alpha, second is numeric, third is numeric, but can sometimes be alpha. The first 3 make up the category. For example, if you have E00 to E89, this is the category for endocrine, nutritional, and metabolic diseases. After the decimal, you have your 4th and 6th characters, which can be alpha or numeric. And this once again captures the etiology, anatomical site, and severity. Finally, the 7th digit is what's called the extension. This will be important to talk about the episode of care, for example, initial, subsequent, or sequelae. It would be more orthospecific for fractures, and it can also get really detailed as far as the number of fetuses for pregnancy. Once again, you do not need to memorize this. I just want to make sure you guys understand what ICD-10 really means as far as the code. So let's talk about an example of conjunctivitis. You have a patient who has conjunctivitis. You are capturing the category if you were to type that in as your primary diagnosis. But if you start to be more specific, you talk about mucopurulent conjunctivitis, now you're including the type. If you say acute follicular conjunctivitis, now you're including the severity. And then finally, if you talk about acute follicular conjunctivitis and include the site or the anatomy, bilateral, now you have a more specific code. You went from 3 to 6 alphanumeric code. So the goal here is to be more specific by including more descriptions of what's going on with the patient. Now you might be wondering how this relates to your documentation. In every way. You as providers, or I should say we as providers, are not being asked to document more. We're just being to be more specific. We are already doing this in our notes. It just needs to be reflected on the code. For example, going back to conjunctivitis, on your HPI you mentioned when it started. That's the acuity. How it happened, the type. On exam, you're able to talk about 1 versus 2 eyes, the anatomy. Or if there's purulent material, once again, the type. So now in your assessment and plan, you are documenting the specific code that will summarize your HPI and exam findings to be able to tell payer sources what is going on with this patient in very detailed. Shifting gears a little bit, let's talk about NOS. Currently, we're using a lot of codes in ICD-9 that deal with not otherwise specified. Well, they're still present in ICD-10. Some of the wording you might see is with unspecified complications. If you use this, it will be a red flag that the provider failed to document the complications. So you want to try to avoid this one. If you see with other specified complications, this one should be okay if you're not really able to find the correct diagnosis code. This is basically saying that the complications are specified, or the complication is specified, but not in the ICD-10 manual. Okay. Once again, if you see not otherwise specified, this is equivalent to with unspecified complications, so you want to avoid. Those providers who frequently use these codes are going to be at higher risk of getting audited. So once again, if you can, avoid anything that's not otherwise that mentions not otherwise specified. So the idea here is to practice documenting a more complete diagnosis, including the site, laterally, complications, acuity, and other characteristics. Let's take a look at some examples. For example, diabetes. You want to mention type 1 versus type 2. You want to mention the degree of control versus uncontrolled, hyperglycemia. Now, in the actual ICD-10 manual, there is no terminology for controlled versus uncontrolled, but Cerner will allow this terminology secondary to the IMO search. And once again, the reason for this is that we as providers all think a little bit differently, so we have to try to find different ways of saying the same thing. So for example, there's going to be many ways to say one thing, but still only be one code. Going back to diabetes, you want to specify the insulin type. If there are complications with diabetes, you want to specify those complications, but that would be a separate diagnosis. And I'll get into an example of that. For example, if you're dealing with kidney disease, hypersmolarity, ophthalmological disease, neurological, circulatory, skin, oral hypoglycemia, and other issues that accompany diabetes. As far as hypertension, there's actually less codes for ICD-10. There's only about 9, and primarily deal with primary versus secondary hypertension. Once again, it's no longer benign or malignant, but Cerner will allow this terminology. Most of us will be using the code essential hypertension, and most of us will probably memorize I-10. Once again, the purpose of this talk is not for you guys to memorize any codes, but just with time, this will be likely engraved in our head. Elevated blood pressure without hypertension will still be present, and other examples of hypertension that deal with heart disease or chronic kidney disease. Secondary hypertension, these are some examples. If you have other secondary hypertension, that's okay to use this terminology. For example, let's say it's drug-related. However, if you see secondary hypertension unspecified, once again, you don't want to use this unspecified terminology. So we'll take a couple examples in Cerner for diabetes and hypertension. Okay, one thing that I want to show you guys here is what's called the diagnosis assistant. There are two symbols you're going to be very familiar with, which is a target symbol and exclamation mark. If you happen to see a target symbol, you're most likely pretty specific in your diagnosis. If you see an exclamation mark, the system is trying to flag you to say, well, maybe you need to be a little more specific. And then it will try to help you find a more specific code. So let's shift. So we have a 45-year-old diabetic hypertensive patient who's here for follow-up labs. He's noted that his blood sugars are elevated, and he's already on multiple oral agents. He's seen the nutritionist. She's seen the nutritionist. She also had a retinal exam done in an outside facility. On exam, you notice that her blood pressure is elevated. Exam's otherwise insignificant. The labs show you that her hemoglobin A1C is 9.8. You see the retinal report, which shows mild diabetic non-proliferative changes on the left eye. So let's talk about what our codes would be. Remember, there's different places to put in the codes, but I'm going to use diagnosis and problems. Other people like to put in their codes under the order section. I'm just going to show that real quick. So this will be your search field here. And I know there are people like to put in their codes to the dashboard. It all depends what you prefer. Okay, so let's talk about essential hypertension. That would be your first diagnosis, right? Notice how you get a target symbol. Now, if you were to type in diabetes type 2, you would get diabetes mellitus type 2. Once again, this will be an appropriate code. Okay, you're getting a target symbol. However, we will go back to our patient. Let's say you decide that, well, this patient is technically uncontrolled. This patient's already on multiple oral agents. You're probably, in some cases, depending on your treatment style, may start insulin. So then your correct code for this visit will be insulin. And once again, I'm just typing in keywords to help search for stuff. You want to put type 2 and uncontrolled. So by just typing in keywords, the system will help you narrow down the diagnosis. So once again, as I mentioned before, there's different ways of saying different things. The only difference here is where the uncontrolled is, beginning or end. Okay, so it doesn't matter which one you pick. So here you have an insulin-dependent type 2 diabetes mellitus uncontrolled. Now, to the payer source, you are saying a very specific condition of the patient. They are not insulin, they're type 2, and they're uncontrolled. Versus if you just send diabetes mellitus type 2, that's just not specific enough, although you're still getting a target symbol. Okay. Now, so you get a retinal report where it says mild diabetic non-proliferative changes. Most of us, including myself, are used to just typing in retinopathy. So if we type in diabetic retinopathy, this is not specific enough. Once again, you're going to get a little exclamation mark. Okay, so you want to be more specific. Now this is where your diagnosis will come about. If you double click the little icon, it'll take you to the screen. And the purpose of this screen is to help narrow it down to a more specific code. So you can tell here you have 64 options. So you want to start off with your clinical core. You know this is type 2 diabetes mellitus. You know this is involving the eye. So you have diabetic retinopathy, and it was mild. So remember from the report, it was non-proliferative. And you want to say without macular edema. Why? Because this is what was mentioned. I mean, it didn't mention in the report, but if you assume if it didn't mention macular edema, that it was not present. By going through your different options here, clinical core, clinical subset, anatomy, laterally, and type, you're able to get a more specific code. So if we save this, you now have a more specific code, and the little exclamation mark goes away. So now you're being more specific, more on target. So we go back to our note. Under the assessment plan, you have essential hypertension. You have insulin-dependent type 2 diabetes mellitus uncontrolled. And you have type 2 diabetes mellitus with mild non-proliferative diabetic retinopathy with macular edema. Okay, notice how there's two different diagnoses, both of them dealing with diabetes. So, the next example that I want to go into is a UTI. This will be for the acute visit, both in the office setting and, let's say, urgent care. So our patient here is a 45-year-old female with history of diabetes, hypertension, with dysuria, started 2 days ago, mild increased frequency, no hematuria, otherwise well. Okay. Exam, vital signs are normal, unsignificant exam. On labs, you notice that there's positive leukocytes, nitrates in blood. There's also many white blood cells, red blood cells, and rods. Okay. So most of us would think, oh, no-brainer. This is a urinary tract infection. So if you type in urinary tract infection and you try to hit your diagnosis assistant, you'll get this assistant to try to find the specific. Okay. Now, if you notice, there's too many choices, 99. Most of us will scroll down, okay, well, there it is, urinary tract infection. This deals with pregnancy, so that didn't help us out, but let's say you just type in urinary tract. It didn't really help us out because, once again, doesn't have to do anything with pregnancy. So, you go back and try to scroll down, and you find urinary tract infection. Site not specified. Perfect. This was the urinary tract. You hit male or female, doesn't matter, and you hit save. So although you've gone through the diagnosis assistant, you still ended up with an exclamation mark. Now here's the reason why. Urinary tract infection is not specific enough. Remember, the urinary tract can mean the bladder, the ureters, the kidneys, the urethra. So what you really want to specify in this case is that this patient has an acute cystitis. So right off the bat, if I type in acute, because remember it started 2 days ago, you type in cystitis, right off the bat you get the target symbol. You are done. So once again, the goal is to minimize getting the exclamation mark by being specific in your search right off the bat. Let's go back to this same patient, different clinical presentation. 45-year-old female with history of diabetes, hypertension, is here secondary to dysuria. It started 2 days ago, mild increase in frequency, no hematuria, but this patient had nausea, vomiting, and left-sided back pain. She's febrile, little tachy, blood pressure stable. She has some CVA tenderness on the left, and she's kind of ill appearing. You have the same lab results, indicating that the patient has an infection. But given her clinical presentation, most of us would say this is a pyelonephritis. So let's type that in. So once again, you get the little exclamation mark. You pop up your diagnosis assistant. Now there's nothing on here about pyelonephritis. What this is actually under is renal tubulointerstitial disorders, and disease classified otherwise, and in the renal interstitial tissue. Once again, if you save that, now you have a target symbol. Okay, a lot of words to say pyelonephritis. However, if you were to off the bat to say acute, once again including the severity of the presentation, pyelonephritis, you don't have to go through the diagnosis assistant to say the same information. Okay. So I'm going to go ahead and remove those. So once again, try to be as specific as you can when you're searching in your field to minimize the risk of you getting an exclamation mark, and that will save you a lot of time and frustration. If you're not able to find the correct diagnosis, that's okay. That's where you have your diagnosis assistant. So we've gone through those. Let's talk about well-child check visits. Very similar to ICD-9. However, they're going to be age-based and abnormal versus abnormal. The newborn is actually day-specific. If it's a newborn under 8 days, that's the code you want to pick. For example, they're for a weight and color check. If it's between 8 to 28 days old, you want to pick that code that specifies the day. The rest, 29 days and older, is the same code for well child. The only difference here is whether or not it's abnormal versus abnormal. So the normal code will be just well child check, well child visit, well examination. This will give you the same code. However, if there's something abnormal in the well child check visit, you want to pick this code. The reason being is it helps to define the complexity of the patient. Now, if you're given vaccines, you must include a separate vaccine at the Z23 code. And the nice thing about ICD-10 is it's no longer specific to the type of vaccine you're giving. This code will encompass all vaccines. Okay. Keywords will be need for vaccination, or you can actually say, let's say you're just giving a Tdap, you can put Tdap vaccine, and that should still give you the same code, which is a Z23. But if you remember need for vaccination, you should be good, or Z23. Now, we are currently not sure if well child check visits will have to have a separate code for vision and hearing screening. Currently, we're putting those CPT codes under the well child check code. Based on my reading, that might change with ICD-10. However, we have not found this information through the CHDP website, so we're just kind of preparing ourselves just in case we have to. So if you're doing a vision screening, you want to specify whether it's normal or abnormal. The terminology will be encountered for vision screening. If it's abnormal, you actually want to type in abnormal vision test. If you're doing a hearing screen, it's passed versus failed. For example, hearing screen passed. There will be a code that says failed hearing screen. That's actually the incorrect Z code. The terminology you want to look for when you have a failed hearing screen is encounter for hearing following failed hearing screen. Although it's not following a previous exam, this is actually the correct terminology you want to look for in Cerner. We're currently already doing developmental screening. Very similar terminology is ICD-9. So encounter for screening for certain developmental disorders in childhood will be one way to search for it. Fluoride treatment, you're currently using a separate code. So in ICD-10, you can just type in prophylactic fluoride treatment or prophylactic fluoride administration. And the nice thing about our clinic here in Magnolia is that our AMAs also got trained on this well child check visit, so they will know how to put in these codes, being that some of the MAs are the ones that do a lot of this coding for us already. So I just want to show you real quick. So we have a well newborn. So once again, there's the 8 to 28 days old. There's the under 8. Okay. And that's just for newborn. Otherwise, it's just your well child. There's your well child check visit. Remember, there's an abnormal finding, which you can see the code is way down here. Or you can just type in well child and just type in abnormal. And it'll help narrow down that search for you. So you would want to pick that one if there's something abnormal. The Z23 vaccines, as I can see, it's Z23. You can type in different ways of saying, but it gives you the same code. So, or just need for vaccination. Whatever you like. Okay? Once again, multiple ways of saying it, but you only have to put this one in to say that you're given vaccines during that visit. Let's talk about our OBs next. So, here you have the same codes for all payer sources. You no longer have to have separate Medi-Cal restricted specific codes, which is kind of nice. Now I'm going to focus primarily on healthy, otherwise healthy OB patients. So if you have a prima gravida, okay, you can type this in, but you will get an exclamation mark. Once again, because you're not being specific enough. So you want to be trimester specific. If you type in prima gravida, first trimester, second trimester, third trimester, then you will get a target symbol saying that you're being specific enough. Once again, you don't have to memorize codes, but it's kind of nice that, you know, it goes Z34.00, and as you're adding a trimester, it matches the number of trimester, 0.01, 0.02, 0.03. Multigravida. Don't put in multigravida by itself. If you put in multigravida by itself in Cerner, you're going to get a Z64.1 code, which actually translates to problems related to multiparity in the ICD-10 manual. What you want to type in is multigravida trimester specific. Okay. When you do this, multigravida first trimester, second trimester, third trimester, you will get, once again, get the correct code and you will get a target symbol. So the thing to walk away from here is to avoid multigravida by itself. Now you're still going to be able to put in other diagnoses such as cholestasis of pregnancy, gestational diabetes. You're still going to be putting twin pregnancy. Those are just other codes that are more specific to what's going on with that patient. Once again, this deals primarily with your otherwise healthy OB patient. And let's take a next look at that real quick so you can see what it looks like in Cerner. So, primary gravida, you can actually just type that in by itself. You can stop and you can just type in first. And there is first trimester. Okay? Or you can just type in trimester and it'll pop up the first and second trimester, so you're picking the right code. Same thing for multigravida. So this is what I was talking about. You pick multigravida by itself, it gives you this code. So once again, you want to pick the trimester that's specific for your patient. Multigravida in the first trimester, second, third, etc. Okay? So, the last thing I want to focus is your preventative visits, your well adult exams. Things you want to search for here is just well adult exam, well adult. But just like a well child check, you want to specify if there's something abnormal. So the keyword is encounter for well adult exam with abnormal findings. Okay. The reason being is if there's something abnormal in your exam findings, you want to tell that to the payers. Same thing for if you're doing a gynecological exam. If there's something abnormal, you want to mention that there is an abnormal finding. If you're collecting a PAP, you want to search for Pap smear for cervical cancer screening or just cervical cancer screening. If you're screening for HPV, there's a code for that as well. The thing about well adult exams is the word screening. That will be the key thing when you're searching. If you're sending a DEXA scan, that'll be screening for osteoporosis. You're placing a PPD, be screening for pulmonary TB. You're searching for, you're screening for colon cancer with guai cards or sending them for a colonoscopy. Or doing breast cancer screening with an exam or mammogram, you want to use the word screening. There will be STI screening as well as versus just an HIV screening code by itself. And remember, if you are given a vaccine, just like your well child check exams, you want to type in your Z23 code that you are given the vaccine. Once again, this helps tell the payer source that you not only did an exam, but you gave a vaccine during this visit. Does make it a more complex visit. Thank you very much for your time. I want to send a special thanks to Leti Garebe for helping me put this presentation together. There's still some time to play with the diagnosis assistant. What you can do is actually put in a future order after October 1st, and you'll be able to see potentially what the diagnosis assistant looks like. Thank you for your time, and wish you good luck.